Based on government data, over 100 million individuals in the United States have contracted COVID-19. For most, the experience has entailed a few unpleasant days. However, approximately 15% of those infected have faced extended symptoms, now referred to as long COVID, despite the pandemic lasting for over 3 years. Medical professionals and researchers still grapple with comprehending many aspects of this condition. One of the challenges has been establishing a clear definition for the condition. A recent study in the Journal of the American Medical Association sought to make progress in this regard. Researchers from Mass General Brigham in Boston surveyed thousands of long COVID patients, asking them to describe their symptoms. The outcome of this study aligned with much of what individuals experiencing long COVID commonly report. From a list of 37 symptoms, the researchers narrowed them down through analyzing infection history and statistical methods to identify 12 key symptoms that characterize long COVID. These symptoms encompass issues like cognitive impairment, dizziness, persistent cough, and a phenomenon termed post-exertional malaise. This malaise refers to instances where simple tasks such as walking across a room or following a recipe can lead to extreme fatigue, highlighting the profound impact of this condition on daily life. This also underscores the ongoing efforts to truly comprehend the nature of this disease. Experts view this study as a step toward establishing a shared framework for understanding long COVID. The connection between long COVID and vaccination status has also been examined. The study indicates a correlation between the two. The survey data was categorized into 4 clusters based on symptom types and severity. Individuals who experienced the most severe symptoms were often those who hadn't completed their full vaccine series, having received only 2 doses of vaccines like Moderna or Pfizer, and had also been infected with COVID multiple times. This combination appeared to be particularly challenging for those who ended up developing long COVID. However, there are some concerns regarding the study's findings and methodology that warrant further exploration and verification. Despite progress, uncertainties about long COVID remain, showcasing the complexity of the condition and the ongoing need for research. Some concerns have been raised by COVID experts regarding this study. One significant reservation revolves around the fact that we are still in the early stages of understanding the condition. The researchers themselves have emphasized that this study is not intended to serve as a diagnostic tool for determining whether someone has long COVID. Instead, its purpose lies in establishing a shared vocabulary to discuss the disease, facilitating the design of clinical trials, refining treatment strategies, and ultimately developing diagnostic tests to definitively identify the condition. Another notable aspect is that the study relies on self-reported survey data rather than utilizing laboratory data to confirm the presence of long COVID in participants. This reliance on survey data introduces limitations due to potential biases and inaccuracies. A subsequent step in the research process would involve investigating whether participants exhibit immune responses indicative of these types of disorders. The challenges individuals face in obtaining adequate medical care for long COVID have been considerable. Many have found themselves adrift within the healthcare system, often for extended periods. Patients have reported struggling to find physicians willing to listen to their experiences, and the process of seeking appropriate care can often feel like a cycle of trial and error. For some, the medical care they receive is described as a journey of uncertainty and frustration. Numerous individuals have turned to online platforms such as Facebook groups for support, with some even having to endure wait times of 6 months or longer for post-COVID care centers. These prolonged wait lists underscore the difficulties patients encounter in accessing the care they urgently require. For many of these individuals, the challenges they face extend beyond their health condition, as they must also contend with practical concerns like transportation, childcare, and reorganizing their lives to accommodate appointments that might take months to secure. The struggle to even accomplish basic tasks like walking across a room has highlighted the profound impact of long COVID on these individuals' lives. What further actions are required to advance our understanding of this condition? What additional efforts are being undertaken to comprehensively grasp long COVID and identify the most effective treatment approaches? The study's focus on these 12 identified symptoms serves as a foundation for crafting treatment strategies. By designing clinical studies targeting these specific symptoms, researchers aim to gauge the outcomes of such interventions. However, there are other avenues of research that demand attention. For instance, investigating long COVID within pediatric patients and delving into its impact on pregnant women constitute vital areas for more comprehensive understanding. These aspects are integral to the broader Recover initiative, led by the National Institutes of Health, which encompasses the scope of this study. Despite these advancements, it's important to acknowledge that there remains a considerable journey ahead. Long COVID patients have exhibited remarkable patience in awaiting progress and answers that are essential for their well-being.